Hi, I'm Kelty. I'm from One Home Wellness Center, and I'm going to teach you today a great somatic exercise called rotating and warming. There are many reasons why your therapist will give this to you, but it's a great exercise to always keep in mind of relaxing areas that might be holding back some tension or guarding or protecting for who knows what reason. And you just want to make sure that you're doing everything super slowly, very relaxedly, being mindful of what you're feeling. So what areas are restricting you from moving, or what areas are moving really well in comparison to ones that maybe aren't moving quite so well. It's all about the brain and the body connecting together and allowing your body to start moving in a way that maybe you're not moving too great at the moment. So this is something you want to do most times, 10 or 15 times, but it's really up to you. There is no exact number, and it always has to be pain-free and gentle. Always. There should never be a time that you feel much of a stretch or a pull or any sort of strain, especially not pain. So I'm going to get Jolene to kind of work through it. I would explain it like this. You're going to let one leg that's bent in a very relaxed position, anywhere at all, if it's a bed, if it's a floor on a yoga mat, as long as it's somewhere comfortable. So you're going to allow one leg, doesn't matter which one to start, you're going to let it fall gently to the side. You're always making sure that one leg, the other leg, stays still. This goes only as far as it feels comfortable. You might feel a little bit of tension on the inside of the leg, totally fine at this point, but not a big pull. When that gets as far as it'll go, you're going to then let the other leg cross down slowly. As you're doing it, you're letting the knee fall down. It's almost like the gravity is pulling it. And this side is just gently over this side. You don't want to hold it there for any length of time, maybe 1 or 2 seconds at the very most. Then you're going to move just the top leg to the opposite side where the right one still stays put. It goes as far as it can go. When it goes as far as it'll go, the other knee crosses over. Make sure the knee crosses over the line of the hip before the pelvis starts to move. Otherwise, that's usually compensation, and there is some restriction in this area, which is what we want to probably tackle. So you let that go gently to one side, and you bring the other leg all the way back. Fully spreading the knees apart. Letting the other leg cross over. Good. You can add in, as you start to get really confident at this, your head starts to move to the opposite side. So this time Jolene will allow the head to stay to the right, allowing this to all open up from all the way up. You might even feel some tension all the way up to there. Then the left leg goes over to the left, or the right leg goes to the right. The head will go to the left leg comes down to the right. That usually feels fabulous. Do it 10 or 15 times, like I said before, but there is no magic number. And depending on what your therapist says, it's usually 2 to 3 times a day.